Here we are. It's me, again, Dr. D, and we're here to talk about Reddit. So this one in particular, I had a good friend of mine reach out to me, and he actually had a question about the AVN, which is an avascular necrosis of the hip. Probably not only the hip, it could probably happen in other places, but the hip is usually where it's associated with. Also, by the way, Bing, for using a abbreviation rant, go. He asked me about it because I won't go into too much detail, obviously, because that's his business to share, not mine. But he did go through a particular procedure that involved a lot of chemo type stuff. And I actually didn't know this until I did some research on it, but I was not aware that a AVN is actually associated with not long-term, but heavy use of things like chemotherapies and yada yada stuff like that. So I actually learned something while doing this too. And in order to kind of tie it into the usual thing that we do here on this channel for the Reddit type stuff, I actually looked up a question about avascular necrosis so that I could kind of hit two birds with one stone, shall we say. But the whole point of this should be mostly to just talk about kind of like what is an AVN and what can chiropractic do for it and what can you just kind of do in general to take a look at it. So let's get started. We are in the there's actually an entire Reddit for this. It's called Avascular Necrosis. And the question goes as such. I'm 31F female and I have avascular necrosis in my right hip. Apologies for the long post. It was discovered by accident in November 2023 because I was experiencing abdominal pain. My primary doctor ordered imaging and the radiologist happened to note that in my report. I have no idea how long I have had it because I was walking around fine without any hip pain. Only after my brain read the words, "You have a hip issue," that my hip now bothers me. Along with right hip pain, I have lower back pain, thigh pain, knee pain, side pain, and groin pain. Sometimes I experience burning symptoms. My doctor believes that my hip is causing my knee pain, and I have to wear a knee brace to help stop the clicking. The doctor said that my knee bones misalign. I went to a hip specialist in January and got x-rays taken on my right hip. He said that I do have avascular necrosis, but it is minor and it's not a rush for immediate surgery. I had my second follow-up appointment in April to see if the bones stayed the same, got better or worse. The doctor said the x-rays are identical to my January imaging, which is good news. He said I might be one of those people whose bone doesn't get worse. My doctor just suggests taking Tylenol and anti-inflammatory for my pain. They don't really help. Everyone is telling me that I should wait as long as possible because I'm young and I still have to go back and get more hip surgery throughout my lifetime. My sister is wanting me to wait until I'm at least 40 to 45. I know that I should be happy that my hip is good for the most part and I don't need a surgery right now. Even though my avascular necrosis is minor, the pain is pretty bad. My hip hurts every day. I have seen 2 hip specialists regarding my avascular necrosis. The specialist I saw September 13th was for second opinion. He said that where the avascular necrosis is located is probably caused by trauma. The avascular necrosis is very small and minor. Both specialists have said that it's not just because I'm only 31 that I don't want to do the surgery. They say that I'm not due to get the surgery yet because the avascular necrosis is very small. The doctor I've been seeing as the main hip specialist even measured the avascular necrosis on the computer and stretched the numbers as much as he could, and it still doesn't meet the requirements. They say that if you get surgery when you aren't due, you could risk it causing you more pain and problems. I don't like how this is unpredictable. Doctors can't really say how long it will take to possibly get worse. So far, imaging I've gotten from December 2023 up until July 10th, 2024, the avascular necrosis has stayed the same and remained unchanged. I did get recent MRI of my right hip. The MRI report from October 30th says that there is bone marrow signal abnormality in the anterior right femoral head, which may reflect an acute microtrabecular fracture or alternatively an area of AVN. Short-term follow-up, non-contest right hip MRI is recommended in 3 months to reassess and help distinguish between these two entities. Tear of the anterior right acetabular labrum. By the end of my day, my lower half feels exhausted and I don't sleep well. I don't know if I should just listen to the doctors and wait till the avascular necrosis progresses, or if I should try to find a doctor who will do the surgery. Looks like you got yourself quite the pickle here. There's a couple things in this post that raise some concern for me. I am not an orthopedic specialist and I will never pretend to be one. They have access to things that I just can't get access to. I can't get access to stuff like, MRIs, or even I think sometimes they use for blood flow type problems. They'll use like an ultrasound. I don't know if ultrasound necessarily would use for the hip. That'd be kind of hard to detect unless they were just checking the main arteries. But you figure there's a lot of things that I can't necessarily specifically answer. I know that MRI without the contrast, I think it's without contrast. Again, I'm not an MRI specialist, but I think if you get the MRI and it shows a compromised, like a change in the bone, I'm pretty sure that is like I want to say that's probably the gold standard. for that type of situation, I guess, this like symptomology. Because the big problem that you have with x-rays is they're very good at kind of picking up big macro stuff. The problem with x-rays is that you can only really see the hard tissue, and hard tissue takes time to react to changes in into soft tissue, soft tissue, especially when it comes to blood type stuff, because as soon as the blood is compromised, it doesn't necessarily mean that the bone is going to change on enough of a level for it to become obvious on an x-ray, which is why I think if there is even a suspected AVN in a hip, I don't know why they don't almost immediately just go for an MRI. So they've taken a couple x-rays on you, this person, obviously. This situation kind of makes me wonder if they're just, I don't want to say they're just guessing, but they might just be drawing conclusions that don't have super supported facts. If they're only taking x-rays and they say that they saw avascular necrosis, I'm not going to doubt that these orthopedic specialists and all that, like they know what they're talking about on some level. But I mean, there's obviously, as I've talked about ad nauseum on here, there's like certain things that like kind of will preclude the way we see certain things. So maybe they've seen stuff in the past that was like, oh yeah, that was an avascular necrosis, blah, blah, blah. And yeah, you're only getting x-rays. It kind of makes me raise my eyebrows. Now, you did say that you got a recent MRI of the right hip, October 30th, which, when did this come out? Oh, 2 years ago. Okay, so this is like a way back. So there's probably some updates and stuff in the comments we'll probably bump into. Anyway, that's when you got a good one in Reddit. Get a follow-up. But yeah, they say that they took the MRI, they saw the lesion or the abnormality when it comes to the blood, or at least the spot on the hip, which is interesting because the fact that they're trying to like compare it to something that is like an anterior acetabular labrum tear is interesting, right? Because when you start having avascular necrosis type problems, what tends to happen is that the area around it starts acting a little funky because the bone itself is starting to become compromised. Again, it's hard for me to say in this kind of situation without seeing more of the actual details when it comes to like the lab report or the imaging reports, and when it comes to even something like I'm not even entirely sure it would appear like on a bone or a blood test. I'm all over the place. Sorry. Yeah, even like a blood test, I'm not even sure would really come up with something for avascular necrosis off the top of my head. But yeah, I mean, clearly you're suffering. The real question is, do you want to get the surgery? Do you need the surgery? And what do you do until you get the surgery? So this is going to come down to a lot of personal opinions. Being a chiro, most people think I'm automatically anti-surgery. I'm, of course, as I always say, I'm anti-unnecessary surgery. But I will say that if this is a true... If you're suffering from symptoms, I will say AVNs, there's not like I'll just like, wait until it goes away kind of situation. Like AVNs, I'm pretty sure just due to the way that they work, I've never, I don't know a ton about it, obviously, in regards to like it going into like remission or whatever, but I don't think that avascular necrosis is something that would just kind of like heal on its own, because it's a blood flow problem. What caused that blood flow problem, after we're done talking about this, we'll kind of go over specifically what an AVN kind of is and what causes it, shall we say. But in this situation, I mean, it's a throw up, right? Because I am actually going to be on the side of, if you have a problem with AVNs, I would actually venture on the side of getting the hip replacement or surgery to at least make sure that it's stable, because ultimately what happens with an AVN is that the bone itself starts to wear away because it starts to die because it's not getting enough blood, because that's ultimately what this is. It's not a bone problem as much as it is a blood is not getting into the bone properly, which causes the bone to wither away and to start to break, essentially. You get a bunch of micro fractures, which is why AVNs are not comfortable in the slightest. Now, usually, at least thinking back on all of the learning, the learning that I've done on these situations, is that you probably are going to feel it more while standing, because weight bearing is going to bother it more than non-weight bearing. So if you're feeling it down, I would actually say you should find some kind of palliative care and get it treated. But I'm going to recommend chiropractic, right? Obviously, if you're going to a chiro, don't let them do like big super chunk movements on it, just because if it is even slightly compromised, you don't want them to extra compromise it. But if you have the area around it treated and all of a sudden all of your symptoms go away, well, that means that if you do have to wait, because if they won't do surgery, if you have to go surgeon shopping just to get the surgery, that's one thing. That could present its own like list of issues. You might have to travel or whatever just to do it or whatever. But if you land on the side of, I'll wait to get the surgery until I'm a little bit older, and I absolutely despise the mentality that, everybody gets their hip replaced or whatever that was kind of alluded to in there. It's like, as you get older, you have to get your hips fixed then. You might as well just wait. I hate that. Never want to see that again, but I see it all the time. If you have it, you are not doomed to have your hips replaced. If you take care of yourself, it's very possible that you never have to get your hips replaced. I despise that way of thinking, but that's just the common American mentality. I assume you're from America, at least, just because, you know, some of the wording in here. But yeah, so ultimately, I think this comes down to, it really is personal preference. As a medical professional, I always say that when it comes to a AVN, earlier might be a little bit better because maybe they can save part of the hip. I'm not entirely sure how orthopedics would approach that, if it is just mostly a stabilization and clearing up the bad enough for the bone to essentially become more stable. Maybe they just add in, I'm gonna say a rod or whatever, but they add in some kind of stabilizing agent, usually some kind of piece of metal or whatever. And if they have to do a full hip surgery, I think that the recovery time and the risks probably a lot lower when you're, especially in your 30s, especially. I mean, there's always risk when you go under the knife, as they say. But I do think that doing it earlier as opposed to like when you're 80, because there's definitely people that are in their 80s and 90s where they have to get a hip surgery, and they're like, we can't do it because you're too old, and if you do, you might just pass away because your body can't handle the system shock. When you're 30, you can probably get away with that stuff pretty easily. Like I said, it's not my favorite answer, but I do say that certain situations require more of the preference of the person itself, and I think ultimately it comes down to that. It's kind of a poopy answer, I admit. It's not as exciting as me saying, yeah, you need to fight the man, you need to do this one thing or another or whatever, but yeah, that's sad. That's unfortunately definitely what it is. You just gotta, it's purely kind of what you want to do. There's risks and benefits to both ways, but the way I always look at it is, if you want a longer amount of like quality of life where you're not in pain, that's just one of those things where I don't think you can fully avoid a surgery on an AVN forever, just because of the way it is, right? So actually, since we're talking about it, let's talk about the way it is. Okay, so what is avascular necrosis? An AVN, as it's also known. There's another thing that's called an AVN we're not going to talk about, but if you do search for AVN, put in medical or diagnosis or something else like that, because you're going to get something else, just as a warning. And make sure there's no kids around, I guess. And so anyway, an AVN is bone that is essentially dying. Avascular means a lack of vascular, which is blood, and then necrosis is death, condition of being dead. So avascular necrosis can occur due to a variety of reasons. It can happen technically anywhere, I think. Variety of reasons that we're probably going to get into in here in just a second. When you think about osteonecrosis, it's going to happen in areas where blood flow can tend to become compromised due to the body depositing something there. Sometimes I think it will like store fat, or the vessels themselves will just be too small. I think it can happen with trauma, where if you hit something hard enough and then the blood in the area becomes compromised due to some reason, which can, it would be very difficult to have a not long period of discussion over, shall we say. But yeah, so the first thing that you got to think about with avascular necrosis is that it doesn't usually have some kind of like super big, like, oh, I caught it. It's not like a cold where you're like walking around and then somebody sneezes on you and you're like, oh God, I caught AVN from somebody. No, it doesn't quite work that way. It has a more subtle manifestation, shall we say. Usually if somebody's starting to suffer from an AVN, it will be from the first thing that they're going to notice is probably pain in that area. For this discussion, we're just going to focus on avascular necrosis of the hip specifically, because that's probably where it is. The vast majority of the time, like 9 times out of 10. I'm sure it can happen anywhere. I'm sure somebody could probably make some kind of point about it being, oh yeah, avascular necrosis of my humeral joint or blah, blah. Yeah, but we're not worried about that right now. Just, and if you are worried about avascular necrosis somewhere else, the general ideas remain the same. The location might just be a little bit different, and the symptoms might change slightly. Based on if it's gravity defying or not. Yeah, anyone technically could be affected by an AVN. I think for the most part, it's not really something 20-year-olds notice. It's probably 30 beyond would be my guess, based on what I remember and what I've been able to find online. I think the reasoning behind that is because even if you actually manifest what might be causing the AVN, you might not even notice the symptoms until you're at least 30, because when you're 20, you just might have the toughness. I guess that's not a great word for it, but your body's able to kind of fight off the pain better than as you get older and things start to, I guess, kind of like wear down. And the biggest concern that you'll have with AVNs is the hip itself. So that the actual hip bone, I'm going to probably put a picture up here of like what the femur looks like. There's this little ball that goes into the socket, and that right there is generally where all of your issues are going to come from. That little ball goes into a little socket. It's called the ball and socket joint of the acetabulum, or what they call, colloquially is called the hip. And the hip, its whole job is to swing the leg so that you can walk and stand to defy gravity. Now, the acetabulum is a big old boy, and it requires a lot of blood because there's a lot of bone, and it sits inside the acetabular joint because it's there to help you defy gravity. So you can walk around, do stuff, play, do work, get from point A to point B in order for you to survive. It's a really, really important joint, and it's a good idea to, at least keep the area around it very, very happy. The acetabular joint, there's a lot of tendons in that area, not super pertinent to what we're about to talk about, but it's important to know that that area is really firm. You don't hear about a lot of hip joints popping out of sockets without there being some other kind of cause, right? They're like, you might have like joint laxity where your ligaments are just not as tough as other people's, and then it might pop out. But I assure you, the body's aware of what the hip does. It seals that sucker up really tight as it possibly can in order for you to be able to do stuff you need to be able to survive. So the first thing that people are going to tend to notice is that while you're standing, you're probably going to feel pain there, and that's because when you're standing, your pelvis, and I might kind of show a picture of it, but the pelvis itself is going to be coming downwards because of gravity, so that the area with the acetabular, so if this is the actual femur, the femur head, this is the acetabular part of the ilium. Technically, the acetabular is made up of 3 different bones. That's a whole other discussion point, but whatever. It sits on there, and it has this like little hook, and the way it should work in a perfect world is that there's space there because there's cartilage there, so you can move it around. It's nice and happy and really, really glidey. When you start to fight gravity, this part, the part of the acetabular joint with the hook, will start to press down because of the fact that it is now gravity defying, right? Gravity comes down, so that it also comes down. And when it starts to push onto the bone, it doesn't necessarily need to touch it directly, but just the gravity of it, just the weight of your body pushing down on it, will start to stress the bones in the area. But the good news is that for most people, the femur is very, very thick. It's a very, very tough bone, and it can just take it. But if you're starting to have an AVN, the lack of blood flow is going to mean that the bone itself starts to necrose, it starts to die, and when that happens, it gets much more brittle. And the pain you're feeling is either the bone itself being stretched, what they call the periosteum, which is the outer covering of a bone. It's filled with nerves because bones are super important, and that's why fractures and bones hurt so bad. It's because there's just tons of nerves inside of our bone for a variety of reasons. Bones are super important just because they make blood, and if you need them to fight off certain things, which again is another discussion for another time. When the bone starts to crack, it hurts real bad, and that's why the pain can linger as opposed to only when you're standing. Like, it might hurt for a little while until you're like off your feet for a little while. Once it starts to hurt when you're not gravity defying, so let's just say when you're laying down, if it's starting to hurt a lot, then it's a good clue that the bone itself is actually breaking and not able to either heal, which is going to have difficulty healing just because of the compromised blood flow anyway, but it's going to have difficulty healing or kind of managing the symptoms, because now there are certain other things around it that are starting to also have problems. This includes the butt muscles, the gluteal muscles. It can include your low back, because now your low back is probably moving differently, because your body's smart. Once it starts to detect that your hip is becoming compromised, your hip doesn't know surgery exists. It doesn't your body's not it doesn't have a cell that's like, oh yeah, I'll just wait till we get a hip replacement and then I'll stop complaining. What happens is that your body starts to notice that it's not working efficiently, so it'll actually subliminally change the way that you walk. So maybe you swing your hip a little bit more as you're recruiting muscles in the low back and your abdominal muscles in order to move the hip to take off some of the strain, because it's trying to avoid the pain that's being put on the hip. And this can manifest as low back pain, or just like a variety of different things, like knee pain, generally speaking, because now you're landing on your leg differently because your body's trying to keep it off there. And the hammies and the quads are going to constantly try and keep your leg straight, but eventually it's a battle that it's going to lose, because osteonecrosis is literally the bone breaking. And like I said, bone doesn't really heal in a way that is productive in that kind of situation. And the lack of blood flow is really going to compromise healing in general, as well as actually contributing to the problem with the lack of that blood flow. So some of the things that can cause it, I know that long-term use of steroids can cause it, because steroids tend to mess with ligaments. It will, I don't want to say it eats away at ligaments, but it definitely deteriorates their ability to function, which is why you're not supposed to be on a corticosteroid for like the majority of the year. I believe, and this might be different, maybe I'll do another little pop-up here, but I think the last time I checked, you should not be getting more than 3 steroid injections over the course of the year, because it will wither away your ligaments, and that causes a lot of different, that can cause a variety of different problems. Thankfully, nowadays, medicine has come up with a variety of different injections that they can give you that aren't steroid-based. Some people may not be able to take those because maybe they'll have an adverse reaction to something they're allergic to inside that medication, or blah, blah, blah. But there's a variety of different ways that they can do it now, that I think that this isn't necessarily as much of a problem as it used to be, because for a long time there, before some of the implications were fully understood, people were definitely getting way too many steroid injections because they were cheap, fast money for people who kind of were just trying to help people manage their pain, and maybe those people didn't want to take care of the problem properly, and they were just looking for a quick fix. A lot of people are. I don't blame anybody for that, but there was definitely some abuse of it for quite a long time. Probably more of an issue before I became a doctor. I was not around for people doing way too many steroid injections. That was probably more of a thing before I came around. So that was probably aughts, 90s kind of thing, if I had to guess. Again, I might put up some kind of statistic to see like maybe if this was a bigger problem. But from what I understand, going through school, this was definitely something that we did discuss. You should not be getting long-term use of steroids for a variety of different things. There's obviously some situations where it's unavoidable, where just taking steroids helps you get through your life or whatever. But that is going to be something that is going to come up where ligaments might start to become a problem. It can happen with trauma, where if you land on something really hard and then your joint actually, or the bone itself like breaks, if it's not healed properly, it could compromise the blood flow in the area. That's a pretty easy, understandable way to do it. You know, the highway gets broken, but then when they rebuild it, they only make it a 1-lane instead of a 2-lane, and then that starts to cause problems. Cancer treatments, radiation is actually not good for the body. That's why we use it to kill cancer cells, because it's very deadly. The hope is that when you use radiation and you kill cancer cells, the body will regrow and heal the parts of your body that are good, as opposed to feeding this cancer cell. And that is kind of a really simple way of looking at why it is that chemotherapy is the way it is. But it will weaken bones in the area of wherever you're getting the radiation, depending on how you do it. Obviously there's a couple different ways to do injections or chemo. There's chemotherapy, there's injections, there's like, you know, actual, like, they can, like, I don't want to say spray it, but, you know, they can, like, actually, like, do surface level, blah, blah, blah. Lots of different ways you can do it. Again, I'm not an oncologist. There's probably millions of different things that go on in cancer stuff that I'm not even fully aware of. Cancer treatment, due to the basic premise of what it is, can cause damage in an area, which will lead to something like an avascular necrosis. It's not necessarily anybody's fault. It's just something that can happen, and it's a shame. But, you know, once you know it's there, it's much easier to deal with if you're at least aware that it's something that could happen. So make sure you don't hide that if you ever go to your PCP with hip pain or even shoulder pain, and just be like, hey, by the way, I had a chemo. Hopefully they know that by now. You know, if you got chemo for whatever reason, but that's not something you want to hide. That's something you want to make sure you bring up. And then any other thing that causes some kind of compromise in the blood flow. I know fatty disposition sometimes happens. I don't know if that's like super common, but like maybe an atherosclerosis. I would think that your body would be pretty wise on that unless it's absolutely uncontrolled. But, you know, again, it could happen. I don't think that would be the most common way of an avian popping around, but I'm sure it can happen. Something that is also linked with avian, I know off the top of my head, is alcohol use. They do say that excessive amounts of alcohol will compromise your ability to have like good blood flow because of fat disposition, I believe. And this is also one of the things that causes like a fatty liver. That's why alcoholics tend to have a much higher preponderance for having fatty liver disease type issues, and especially in an American situation where what they call like trunk fat. I forget the technical term for it, but there's Americans, we tend to have like American bellies. You might call it like a beer belly type situation. Abdominal fat, if there's like a technical term for it, where if fat is in that area, it will cause visceral organ fatty disposition, which is very unhealthy. It's the worst way to carry fat for a variety of reasons. But I believe it's kind of linked in that similar train of thought, where if you just have a bunch of fat floating around, there's a chance that it might start to block arteries and veins that are, I guess it doesn't really block veins per se, but, you know, it'll block arteries that are more important for survival than others, because the further away you get from the heart, the smaller the arteries tend to get. But of course the hip is really big, so generally speaking, I imagine most of the arteries that go in there are pretty big, just because there is the femoral artery that rides right along it. And if something does happen, it's probably just because one of those little tributary rivers that go off of the femoral joint are just getting blocked up by something. It's probably fat or some kind of, again, like compromise to the area. And I did look up just to make sure I didn't miss anything for this. There is a list of medical conditions that are usually associated with avascular necrosis. I'm probably going to put a picture up for it. But to list them off, if you are just listening to this, it's usually associated with pancreatitis, Gaucher disease, HIV, AIDS, systemic lupus erythematosus, sickle cell, anemia, decompression sickness, also known as diver's disease or the bends. That's the one where if you come up too fast, it can affect, it's a blood flow issue, so that's not totally surprising. And then cancer, usually leukemia is the big one because leukemia is a blood-based like cancer because blood is made in the bones. So if there's a blood-based issue, bones are one of the first places you look because that's where it's made. So if you notice something's coming off the factory floor a little funky, you go back to the factory and the factory might have some kind of issue. So yeah, ultimately, that's the general gist of an avascular necrosis. Really, the biggest risk for it is if you are doing something and you land on it where a little bit too hard while it's already becoming compromised, you really don't want it to cave in. A caved in hip bone is going to feel real bad. It's going to feel real bad, and that one's going to take you off your feet. Potentially forever, but it's definitely going to keep you off your feet for quite a while. That will definitely need to either be replaced with a surgical intervention, or you might just not be able to walk again because of the fact that it's going to hurt so bad to put weight on that thing. So it's really important that if you know you have an AVN, you do not want to do things that cause the bone itself to become compromised any more than it might already be. A good idea is to strengthen the muscles around it, but don't necessarily do like super hard, very specific like hip joint type movements. You might not want to do like maybe, I don't want to say squats, probably okay. You may not want to do weighted squats. Stuff like leg presses and all that, you really want to make sure you keep your eyes on it because you really don't want that thing extra effort. That'd be bad. That could be real bad. And then anything that you could do to make it a little bit better or at least to prevent more issues from coming further down the line, focus on anything that's going to improve your blood flow. Anything that compromises blood flow, definitely try to avoid it. So I think smoking and obviously eating fatty foods, cardio type stuff is going to be really helpful just to help improve your blood flow. I don't know if nitric oxide would necessarily be all that useful for far away joints like that. I would actually have to look into that. I might put yes or no on that one. But anything that's going to help improve the blood flow to that area is going to be really helpful. I imagine there's a variety of ways to do that. Massage is probably not a bad idea. Chiropractic actually probably would really be really good for that too. Just because when you have certain areas that are becoming subluxated, which is what chiros deal with, if you adjust the back, because there's a lot of arteries that go through the spine, it will just improve the blood flow overall to anywhere that is downstream of that particular artery. I'm not saying that chiropractic is the treatment for an AVN. This is actually one of those few times where I would say a chiropractor is not necessarily the first go-to. But as I was alluding to before, if you go to some kind of conservative treatment, chiro being, in my opinion, the biggest one out of them, you should get some kind of relief at least, where if they take the area around it and massage the area and get the muscles to relax and also mobilize all the areas around it, it should help deal with the symptoms, but the cause itself remains, and how to deal with that cause is definitely more of something you want to talk about with an MD. I suppose if it's cancer related, maybe an oncologist. I'm not entirely sure who covers it on that one, but the orthopedic that they either refer you to or is a part of the team is going to be really important for that. Again, I don't necessarily think that there's ways to treat it that aren't going to be hinged on a surgical situation. And something that is really important to remember about AVNs is that because the joint itself is changing shape and becoming something else, you always want to keep your eye on the integrity of the joint itself. That's a chiropractic thing for sure. But as your bone, if it actually physically starts to cave in and, pass away, the cartilage in that area will probably age a little bit quicker than other areas, purely because of the fact that it's moving in a way it may not necessarily like, or it's having undue stress placed upon it. Chiropractic could help with that. It could help reduce the arthritis, I guess would probably be the best word for it, that might manifest in your hip if this isn't fully managed, if it's not managed well, shall we say. So, like I said, it's not a great answer as far as a chiro looking on it in regards to me saying that we are the cure-all, answer-all to every single issue that's ever happened in the human body. Being adjusted will help. It will definitely preserve what you have much better than not getting it. But I do know, and I do honest to goodness think deep down in my body that it is a surgical situation. It's up to you when you want to get that surgery. I know they have certain rules that apply to getting those surgeries. I'm just going to trust that those numbers have been well researched and are being followed and adhered to by the surgical consults that you might have. I would say listen to them, do your own research in that regard, see if you agree with them. If you don't, maybe go get a second opinion, and everything you can do to help just reduce the symptoms in a way for you to be able to survive and maybe live a little bit of a happier life, I say go for it. That's my ultimate answer for it. We could do a couple of comments to see if I'm in the right or if I'm just a big dummy.
Hey there, it's me, Dr. D, and I know you're watching this channel and I really appreciate it, and we're having a lot of fun, but something that I have to ask you, can you please like, favorite, and subscribe to this channel? It'd be a really, really helpful thing, and you know, little guys like me, little old chiropractors like me, just trying to make our way in this world here. I keep getting told I'm supposed to tell you guys to do this stuff, so please do. And if you can go to that little bell, I think it's like below us, and you give that a little click, and it says to just remind you when the videos come out, that would just be swell. So thank you very much for watching our videos and making sure that we feel as appreciated as we do, and I can't wait to see you in the next one. I get back to the video.
I was right. There's definitely a little bit of follow-up. It might be like right after it, but there's definitely some follow-up questions here. I'll kind of cherry pick what we put up here. But can I ask what country you are in? Essentially, there is absolutely no way to know after 3 months of imaging if you are in the 1% who remain static. The problem is that you are in this amount of pain now. With AVN, your hip will continue with micro cracks until it destroys itself. There are strong reasons not to allow the hip to get so bad it affects all the structures around it. It's kind of what I was getting at there with the chiropractic approach to it, shall we say. The AVN, is it visible on x-ray? By no means. Are you too young to get a replacement? 93% of people walking around with a replacement still have their replacement functional after 20 years in Australia. Aussie, mate. Neil, what are you doing, mate? You can expect the hip to last 30 plus years, and sorry, Kara's really got me on the Neil seal thing. And if you need a revision to replace it, then just do that when it wears out. Don't spend your youth being in such pain. You can have a small lesion, and that can still leave you in absolute agony. The fact that you have the labrum tear, that's just a bonus. That's not great. You just need a replacement. There are no complications if you get this done at 31 5 years ago. The average diagnosis for the average age for diagnosis was 32. Yeah, there you go. Yeah, see, there you go. I think I'm pretty much on the. I was right about all that. Yeah, like I said, I don't think waiting until your 40s and 50s sounds like a very fun life. I mean, you got one life to live. The fact that you have people in your life that are, you know, trying to take care of you who say, yeah, you should just suffer for a little while for like 10 years. I hate to break it to you, but at the best of times, you're going to get like 80 years on this planet. 10 years being in misery, that's an eighth of your life where you just have to think about every single time you take a step. I don't know if I like that. Don't know if I'm a big fan of that. But, you know, again, there's probably factors that I may not be fully aware of. If you have the opportunity to get it replaced and you are comfortable with that, I highly, you know, endorse your own patient empowerment. Get it done, and I guess tell us how it goes, I guess. After 2 years, I imagine you probably have gotten it. I hope I find it in here. It's like, oh, yeah, I did it. I feel so much better. I hope that's what I find. Here's another lovely one. AVN causes the femoral head to slowly splinter, fracture, and collapse. Like I was saying, in turn, the cartilage gets obliterated and the acetabulum, the socket, gets destroyed. You will not last until 45 without ending up permanently disabled in a wheelchair. At that point, your muscles will atrophy and getting a replacement will only be half the battle. Get it done now while you're young and alive so you can continue to enjoy your life and mobility. Yeah, that's exactly what I would say. Yeah, actually, great. I'm glad I'm not crazy. I'm like, yeah, I just, you know, just suffer forever. Yeah, if you get that done earlier than later, I do think you'll recover a lot better. The recovery time for certain a hip surgery, you're usually off your feet for quite a while. But if you're younger, it's a lot easier to get in there, and even just doing some physical therapy afterwards is a lot easier when you still have a 31, I think her age was, 31-year-old muscles, I'll just say. You know, you can do a lot better. Here's one. This is nuts. My surgeon wasted 0 time. I hear these stories of people being forced to wait years, and it blows my mind. Quality of life is complete poop when you have full collapse and other issues. I get the system is what it is, but forcing a person to just wait it out and suffer more damage and pain and immobility is ludicrous. We shouldn't have to get... Sorry. We have to get our best advocate for this disease. It's pathetic when doctors clearly see imminent joint failure and only choose to throw pills at it. Sorry, just ranting a bit. Ah, brother, I've been ranting about that for a while. Yeah, listen, I'm not a huge fan of the way MDs sometimes treat certain things. I do think that the quality of life is something that I think some doctors might kind of tend to forget about. I mean, it's one of the advantages of chiro, right? Is, you know, we can't necessarily cure a lot of things, but we do help you at least have a better quality of life for a lot of things that MDs say that we can't help with and blah, blah, blah. I'm not going to go on an anti-MD versus chiro rant or whatever, but I do think that this comment is a good clue into that kind of like way of looking at it. It is crazy. I don't know why MDs would allow somebody to be totally miserable like that, especially if the other indicators of the patient are that after they get it done, they'll go back to doing things that have a higher quality of life. So if like somebody comes in and they're like a couch potato and they're like, yeah, you know, I play video. I'm gonna throw myself under the bus here. I play video games all day, and I really just don't have much interest in moving. Well, then maybe you can wait longer because you may not suffer necessarily as many symptoms due to moving too much. But if you have somebody who is like wants to be a sports star or something like that, where, you know, they have like they have this AVN thing going up, and they got like some kind of scholarship or whatever. It might be a little 30, might be a little late for scholarships and all that stuff, but you know what I mean? Like that kind of situation where you have a lifestyle benefit that is hinging on the fact that you can't even stand up. To be able to like just say, no, don't worry about it, we'll just wait until you're 40. That's tough. That's real tough. I don't know if I'm a fan of that. Yeah, don't get a second opinion. If you have multiple doctors saying like, yeah, we just can't touch it because of X factor, especially if they give you a factor that is explainable and it makes sense, that's one thing. But if they're just like, no, I don't want the risk, then you need to get a second opinion. Here's a good one. Somebody posted something and then there was a quick response. Hey, could you tell how your life is after the replacement compared to the life you led with the issue? Is it better? Is there pain or any limitations? This person is talking to somebody who's not the OP, which is the original post. Bing! This isn't the person that actually asked the question. It's somebody else who said that they had the thing managed. The person that had the replacement says limitations, no trampolines. Yeah, I suppose trampolines probably wouldn't be great for an AVN. This absolutely crushed me as my son was 5 at the time running. Risk of quicker degeneration of replacements. Yeah, I could probably see that just because replacements can't necessarily regrow or thicken like bones can. So I guess I never really thought of that with hip replacements. That kind of stinks. I would. That's super dark there. I'd be sad about that. I refrained from waterboarding, skiing for the same reason. Again, the trampoline was a tough blow, traded it all for the pain-free life that I am now living. It also gave me a greater appreciation for the simply thing, since I was confined to a wheelchair before I was able to get surgery. Being stuck into a wheelchair like that for a situation that is correctable like that, that's brutal. I'm not a big fan of that. This will be the last one. There's a little bit of a discussion with the OP on this one. The replies were mostly just the person asking questions. There does not appear to be a follow-up, so I'm not entirely sure if the person did get a hip replacement or not, or if they got any better or whatever, but they were asking about the physical therapy stuff after this. I just want to show it. Nothing really all that interesting, but this person goes to say, have you tried physical therapy? I didn't want to go to physical therapy because I also have labral tears in my right hip, but as soon as I started going to physical therapy and also went to massage therapy for my back, it made a huge difference. It doesn't always take the pain away, but it does take it down enough to be able to function. You can also try acupuncture, which I've heard actually does work. Pain is relative, and when you're treating pain, medications don't always work. You have to have several things going at once. I also have a TENS unit, but it's a huge one, and it's much stronger, and I put it on daily. Yeah, the same thing with the chiropractic concept. If you go to a chiro and they do light massage on that area and mobilize the joints effectively and just get the area to move a lot better, the pain is going to feel a lot better. It doesn't look like he tried chiro, but I know for a fact I have treated people with an AVN, and when they left, they felt better, but before I knew it was a full-blown AVN, the pain would come back in a way that showed that ultimately we could make it feel better, but whatever we were doing wasn't necessarily what I used the word cautiously, fix it, which is how we found out that it was an AVN, because I was treating it, and it wasn't getting better. I was a baby chiro at the time, and it kind of slipped under my radar, and they did go get it checked out. Thankfully, I hadn't really done anything super big on the hip because hips are kind of weird to mobilize the whole thing. It was mostly gentle on that one because he wanted it to be gentle, which we did. Everything we did, or I did, made it feel better, but we did find out that it was an AVN and that ultimately speaking, he needed to get the surgery, which he did, and he healed up quite marvelously. He came a couple times afterwards, and I treated him and kind of resolved a little bit of the lingering issues, which again is a whole nother discussion in itself with adjusting, hip replacements. So just something to kind of keep in mind. I do agree. I do think having different modalities help treat it is going to help you deal with the lifestyle implications of it. So big fan, big supporter of that. Well, there you go. I hope that was helpful. That's my opinion of it. Obviously, there are probably other chiros out there who have different opinions of it. There's probably a strong predilection from the chiropractic community to say that we just never touch it. Don't touch an AVN. I agree. Don't necessarily go for the hip itself, but I think the areas around it probably safe to say. It's probably safe, safe to play. I don't know if that's the right way to put it, but you could definitely do stuff in those areas, and I think you'll be fine, especially if it brings somebody relief. Well, there you go. That's big stuff there. So if you guys have any other specific questions you want me to go over, send me a message or make a comment down below, and if I read it, I can definitely throw it into the schedule. I have a little to-do list now on my phone. I'm like, oh yeah, I'm gonna go over this list. It's been really great. Definitely helps me organize my crazy thoughts over the course of the day as I just sit here and think what do I do next? There's so much to do. But thank you very much for watching this. I hope you really keep it popping out there. You're great. I love you. I hope you have an absolutely wonderful day. Keep having wonderful days. I'll see you next week where I'll tell you all this again, and I'll talk to you then.